ever seen in world
This meeting
history.
is being recorded.
In the first World War II, 50 to 80 million people died, but 73 million babies are being killed by abortion every year, according to Life Equip Global. And it violates the fundamental role of a man as a protector, and it strips the woman of her position as a life bearer or nurturer. So it is actually, for those of us who are Christians, we know that it is Satan's greatest onslaught on the sovereignty of God. And according to Hippocrates, the father of medicine, we ought to protect the sanctity of life from conception until natural death. So abortion affects hundreds of millions of lives, from trauma to the mother and the child. Both the mother and the child suffer, and everybody who's related to them. So we've talked about the over 60 million abortions have occurred in the United States alone since 1973, Roe versus Wade. And India, 50 million, China, 93 million. Asia has the largest number of abortions in the world. And in Africa, estimated that there are 5 to 10 million abortions annually. And those are the abortion rates: 43 per 1,000 live births in Eastern Europe, 39 in the Caribbean, 38 in Eastern Africa, 36 per 1,000 in Southeastern Asia, and 36 per 1,000 in Middle Africa. The lies women are being told is by the sexual and reproductive health rights ideology promoted by the World Health Organization, is that abortion is their right, it's your body, it's your choice, it's not really a baby, and abortion is reproductive health. So last week we did the human life cycle. Can just briefly recap, because we said that anytime you destroy any part of the human life cycle, that the whole of humanity is affected. So we're talking about this part of the cycle where after getting married, the two come together, the husband and wife come together, a biological male and a biological female come together, and in procreation, they come together and procreate, and the baby, this is the baby being expected. This is the part of the human life cycle that we discussed last week. We first need to define abortion as in light of the Constitution of Kenya, because there are people who want to say that abortion is allowed in the Constitution of Kenya. So Article 26 says that every person has the right to life. Number 1. 2, the life of a person begins at conception. Number 3, a person shall not be deprived of life intentionally except to the extent authorized by the Constitution or any other written law. Abortion is not permitted unless, in the opinion of a trained health profession, there is need of emergency treatment or the life or health of the mother is in danger, or if permitted by any other written law. So the term abortion in the Constitution is a simple English word and it's not a medical term. Abort means to deliberately terminate, and terminate means to bring to an end. So abortion in the Constitution would mean to deliberately bring to an end. So in relation to the Constitution of Kenya, the abortion would mean deliberately terminate a pregnancy or bring it to an end. The opinion of a trained health professional is a diagnosis reached after taking a good history of the presenting illness, examination, and performing tests where relevant. So the Constitution expects the trained health professional to first reach an opinion diagnosis before deliberately bringing a pregnancy to an end. Okay, so after that diagnosis, they can, the life or health of the mother is in danger, or if permitted by any other written law. So it's morally ethical for a trained health professional to deliberately bring a pregnancy to an end if there's need for emergency treatment. But it must be supported by a clear diagnosis, and we never kill the baby directly it must always, deliberately bringing the pregnancy to an end must always respect the life of the unborn person. So for example, in an ectopic pregnancy, that's an abnormal pregnancy whereby the baby has implanted in the fallopian tube and the baby will die when the tube is removed. So you go and remove the tube, and as a consequence, the baby will die, but you didn't go directly to kill the child. It's called double effect. For example, in preeclampsia with women who have pregnancy-induced hypertension, with impending renal kidney failure, and they're having seizures, a cesarean section can be done after trying all the medications to bring down her blood pressure. So the World Health Organization definition of abortion contradicts our constitution, because the World Health Organization says abortion is a pregnancy termination prior to 20 weeks gestation. And prior to 20 weeks gestation, even if the method used does not deliberately kill the unborn child, it will not, he or she will not survive. So any pregnancy termination prior to 20 weeks is deliberately killing the unborn child. The World Health Organization also goes on to describe unsafe abortion as a procedure for terminating an unwanted pregnancy. Unwanted pregnancy is not even a medical term, that's a social term, either by persons lacking the necessary skills or an environment lacking minimal standards, or both. World Health Organization, safe abortion is a procedure for terminating an unwanted pregnancy by persons lacking the necessary skills and in an environment meeting the minimal standards. In none of these have they talked about the fact that a child has been killed. In none of them have they talked about the damage to the mother. So we don't agree with this. So we're going to work towards using the word abortion to be defined, to stop using the word abortion. But since people are still using the term abortion, we are going to always mean that it defined as the deliberate killing of the preborn person. So health is, according to World Health Organization, the complete mental, physical, and social well-being of a person, and not just the absence of infirmity. And reproductive health is the same in all matters relating to the reproduction and its functions and processes. We did have a meeting in ICBD 2019 called Familia et Vitae, the pro-life and pro-family meeting. And we had several doctors there and mental health professionals and sociologists. And we concluded that this definition is inadequate. And we came up with the conclusion that health is defined as the complete mental, physical, family, spiritual, and environmental well-being of a person, and not just the absence of disease or infirmity. That is important because well-being encompasses the whole person, and the health and wellness movement has discovered that all these occupational, environmental, social, financial, physical, emotional, spiritual, intellectual are important for a person's health. So reproductive health is a complete state of physical, mental, spiritual, family, and environmental well-being, and not merely the absence of disease or infirmity in all matters reproduction. And we had to define the human person. The human person is an animal physically we are of the animal species Homo sapiens, but we are immortal spirits made in the image and likeness of God, male and female, according to the Bible, Genesis 1:27-28. So that is where our dignity comes from, the fact that we're made in the image and likeness of God. And I have a soul which comprises my mind, my emotions, and my free will, and I live in a body. So disease is any harmful deviation from the normal structure, anatomy, or function of an organism, generally associated with signs and symptoms. And we go to, when does life begin? So life begins, God had decided to create a human being through the sexual act of sexual intercourse. between a biological man and a biological woman. Fertilization or conception happens when the sperm meets the egg. The sperm from the man and meets the egg of the woman, and they combine to form a zygote. That is the beginning of life. If each one of us started as a single cell, okay? So the zygote contains all the genetic information needed for development. For example, our sex, our eye, hair color, and we just need a place to grow in the mother's womb, and we are unique and irreplaceable. Okay, so both the sperm and the egg, if left alone, they will die as sperm and egg. But the fact that they come together, a human being is created. Okay, so we'll do a bit of the woman's anatomy and physiology. This is the womb of the woman, and these are the eggs on either side. Each girl is born with 1 to 2 million eggs and starts ovulating once a month at puberty. So that means the egg is produced. Ovulation is when an egg is produced. So this is released from one of the 2 ovaries and travels down the fallopian tubes where fertilization may occur. So this is a cross-section. This is the uterus, and this is the ovary, and this is the egg, which is maturing, and this is how it is released. And it passes into the fallopian tube where fertilization takes place. And as he or she continues dividing, they reach the uterus and they implant into the uterine wall. So here it is called a zygote. Here, he or she is called a morula. By the time he or she reaches the uterus, 5 to 6 days later, he or she is called a blastocyst. He or she implants and is called an embryo. And then after 8 weeks, the baby is called a fetus until birth. But all of these stages, the child is alive. All right. So the baby, these are the baby names. There's a 9-month journey of growth and maturation leading to delivery. If the egg is not fertilized, it continues to the uterus and is released in menstruation. The menstrual cycle is 24 to 36 days long. So the reason why I'm defining all these things is that we need to understand the terminology, because a lot of deceptive terminology is used out there. That's why we were spending a bit of time on this. Medicine is the science of diagnosis, treatment, and prevention of disease. Pregnancy is not a disease, and that is why contraceptives are not medicines but drugs. A pregnancy that is a disease, the only one is an ectopic pregnancy where the baby is implanted in the fallopian tube. So we had the miracle of life. Fetal development, 12 days after conception, the baby embeds in the uterine lining. After 28 days, the baby has a heartbeat, which is detectable at 6 weeks, and there's also brain waves. So at 7 weeks, every essential organ has begun to form, the eyelids and the tongue. At 8 weeks, everything present in an adult human is present in the child that is developing in the womb. So every single one of us began our life as a fetus in the womb. There are 3 trimesters up to 40 weeks. Less than 7 weeks is considered to be premature. So you have the first trimester of pregnancy, which is 0 to 12 weeks. And I don't know whether you're able to see a 3-month-old baby. I have a model here of a 3-month-old baby, which is 7 centimeters long. Are you able to see it clearly?
Yes. Yes.
Yes, we can.
Yeah. So this baby, this is how the baby looks at 3 months. You can see that their arms, their legs, there's a face, their toes, their ears. So all the organs that were supposed to be there were present by the 8th week. So let nobody cheat you that this is a blob of cells. This is a human being and it's a baby. Okay. So then the second trimester is from 13 to 26 weeks. And I have a baby here who is 26 weeks old, a model of a baby rather. And according to the measurements, it's 13 centimeters long. This is how a baby of 26 weeks looks. You can see baby is completely fully formed and sleeping nicely in his mother's womb. Then you have the third trimester, which is 27 to 40 weeks. And this is a baby, 27 to 40 weeks. This particular one is 21 centimeters long. And he or she is 30 weeks old. So you can see this is just a bigger version of the tiny little baby we held in the beginning. And so it's not a potential life, but a person with infinite potential and an immortal soul. So the father of medicine, Hippocrates, said, we should never do any harm and always do good and always give informed consent for any kind of treatment and be just and fair to all. So it is in the basis of a medical opinion that a doctor offers treatment. And in in medicine, abortion is a diagnosis, not a treatment. For example, missed abortion, incomplete abortion, inevitable abortion or miscarriage, a spontaneous abortion. So there's no diagnosis. I want to make this very clear. There is no diagnosis, medical opinion, for which a doctor can offer abortion, which is a deliberate killing of the preborn person, as treatment. So if a lady comes in with what she's calling an unwanted pregnancy, my diagnosis is normal pregnancy with a psychological condition, which probably we can call, that is a crisis pregnancy, which is it's a social problem, but it's a normal pregnancy. And I have two patients whose lives I have to take care of. Okay. So just a note about how contraceptives work, especially the hormonal contraceptives, which are abortifacient. An abortifacient is any substance or drug or procedure that inhibits implantation of the baby. So the pill works by preventing implantation of the baby, and it also works by inhibiting ovulation and delaying ovum transport and thickening the cervical mucus in the cervix. Because when it thickens the cervical mucus, the sperm cannot pass. But these other methods don't always work. So in case that there's a conception that takes place, pills prevent implantation, which means that they're abortifacient. Now I'll go to the abortion methods, and we will know that I first need to warn you that the abortion methods that we're going to show are graphic and disturbing. And if somebody is watching, especially somebody who has had an abortion, then it can be quite traumatic. So you need to, that's my disclaimer as you watch these. And so we should note that any woman in her childbearing years who is sexually active could be at risk of pregnancy. And we need to educate all women about the abortion procedures, because she can get a crisis pregnancy. And also the contraceptive methods, there's none of them that is 100% effective. They all have a failure rate, despite what the mass media says or the World Health Organization. Okay, so it's vital that we know what an abortion is. There are two types. They can be chemical or surgical. Surgical is more invasive than chemical, but both of them are painful. So we'll talk about the chemical abortion procedures. And OPP, if you're there, please put the first video about the abortion pill or the morning after pill so that we can see how they work? Are you there, OPP?
You may need to stop sharing.
Yeah.
First. Yeah. Stop sharing your screen first.
Yes. Okay, so then you'll show all of them one after another. They're about 3.5 minutes long so that we can
There is one
understand.
I've seen which is 12 minutes.
No, don't show that one. That's the miracle life, of life, which we were supposed to see in the beginning. So please don't put that one, eh?
Okay.
So I stop sharing, eh?
Yes.
Sawa. I can't hear anything. Can anybody hear anything?
No, there's no sound.
There's no sound.
Otieno.
Okay, let me check again.
Still can't hear anything.
You are muted, Otieno. That's why you can't hear.
Otieno, you're muted. Please unmute.
It might not be. I know it's probably that because I'm using a browser for Zoom and I'm sharing a browser. Let me try again. It's probably because I'm using a browser. Are you able to hear?
You need to increase the volume. Okay, please start again. Thank you. Increase the volume.
My name is Dr. Anthony Clementino. I'm a practicing obstetrician gynecologist.
If the volume is very low, eh?
Today I'm going to describe the first
yeah, probably because
this is a procedure in which the mother swallows pills in order to terminate her baby, and it is performed.
I may need to download them first.
It's okay. People will read the subtitles. Just start again, please.
The woman takes pills which contain the crystal. My name is Dr. Anthony Clementino. I'm a practicing obstetrician gynecologist, and I performed over 1,200 abortions. Today I'm going to describe a first trimester medical. This is a procedure in which the mother swallows pills in order to terminate her baby, and it is performed at the 10th week of pregnancy. The procedure involves 2 steps. Step 1. At the abortion clinic or doctor's office, the woman takes pills which contain mifepristone, also called RU46. RU46 blocks the action of the hormone called progesterone. Progesterone is naturally produced in the mother's body to stabilize the lining of the uterus. When RU46 blocks progesterone, the lining of the mother's uterus breaks down, cutting off blood and nourishment to the baby, and then dies inside the mother's womb. It is important to note that even after it has been taken, it is possible to reverse the effects of RU46 and save the baby if progesterone is administered. The sooner, the better. Step 2. 24 to 48 hours after taking RU46, the woman takes misoprostol, also called Cytotec, that is administered either orally or vaginally. RU46 and misoprostol together cause severe cramping, contractions, and often heavy bleeding, force the dead baby out of the woman's uterus. The process can be very intense and painful, and the bleeding and contractions can last for a few hours, days. While she could lose her baby anytime and anywhere during this process, the woman will often sit on a toilet as she prepares to expel the child, and she will then flush. She may even see her dead baby within the pregnancy center. At 9 weeks, for example, the baby will be almost an inch long, and if she looks carefully, she might be able to count the fingers and toes. After she has disposed of her baby, the woman may have bleeding and spotting for several weeks. Bleeding lasts, on average, 9 to 16 days. 8% of women bleed more than 30 days, and 1% require hospitalization because of heavy bleeding. The failure rate increases as the pregnancy progresses. If failure occurs, she will usually be offered a surgical abortion. For the mother, medical abortion often causes abdominal pain, nausea, vomiting, diarrhea, headache, and heavy bleeding. Maternal deaths have occurred, most frequently due to infection and undiagnosed ectopic pregnancy. As I mentioned at the beginning, I'm Dr. Anthony Levatino, and in the early part of my career as an OBGYN, I performed over 1,200 abortions. One day, after completing one of these abortions, I looked at the remains of a preborn child whose life I had ended, and all I could see was someone's son or daughter. I came to realize that killing a baby at any stage of pregnancy for any reason is wrong. I want you to know today, no matter where you're at or what you've done, you can change. Make a decision today to protect the preborn. Thank you for your time.
I will no longer do any more abortions. When you finally figure out that killing a baby that big for money is wrong, and it doesn't take you too long to figure out it doesn't matter if the baby is this big, or this big, or this big, or maybe even this big, it's all the same. And I haven't done any since then, and I never will.
Okay, OPP.
Did you hear any better?
Yes, thank you.
Or
So
I,
we can just watch two more. The one that's surgical
okay.
early and the one surgical mid-trimester. And then when it comes to the point of him talking at the very end, then you can cut it short because we have already listened to that part. So please show the first trimester surgical and second trimester surgical. Any luck? There's no sound, eh? OPP?
Oh, okay, sawa, sawa. Let
There's
me.
no sound at all.
Yeah, it's like I muted again. Sorry. Let me restart. By the way, I tried to download it. Let me see if it downloaded so that I put full sound.
So if anyone has joined, we're discussing the trauma of abortion. And right now we have defined abortion as the deliberately killing of the preborn person. And we are showing videos on how it is done, the procedures, and we are warning you that they are disturbing.
My name is Dr. Anthony Levatino. I'm a practicing obstetrician gynecologist, and I've performed over 1,200 abortions. Today, I'm going to describe a first trimester surgical abortion called suction DNC, dilatation and curettage. This is the most frequently performed abortion and is used typically from 5 to 13 weeks of pregnancy. After administering anesthesia, the abortionist uses a speculum like this. This is placed inside the vagina and opened using this screw on the side, allowing the abortionist to see the cervix, the entrance to the uterus. The cervix acts as a gate that stays closed for the duration of pregnancy, protecting the baby until it is ready for birth. The abortionist uses a series of metal rods called dilators, like these, which increase in thickness, and inserts them into the cervix to dilate it, gaining access to the inside of the uterus where the baby resides. The baby has a heartbeat, fingers, toes, arms, and legs, but its bones are still weak and fragile. The abortionist takes a suction catheter like this one. This is a 14 French suction catheter. It's clear plastic, about 9 inches long, and it has a hole through the center. It is inserted through the cervix into the uterus. The suction machine is then turned on with a force 10 to 20 times more powerful than your household vacuum cleaner. The baby is rapidly torn apart by the force of the suction and squeezed through this tubing down into the suction machine, followed by the placenta. Though the uterus is mostly emptied at this point, one of the risks of a suction DNC is incomplete abortion. Essentially, pieces of the baby or placenta left behind. This can lead to infection or bleeding. In an attempt to prevent this, the abortionist uses a curette to scrape the lining of the uterus. The curette is basically a long-handled curved blade. Once the uterus is empty, the speculum is removed and the abortion is complete. Risks of suction DNC include perforation or laceration of the uterus or cervix, potentially damaging intestine, bladder, and nearby blood vessels, hemorrhage, infection, and rare instances, even death. Future pregnancies are also at a greater risk for loss or premature delivery due to abortion-related trauma and injury to the cervix. As I mentioned at the beginning, I'm Dr. Anthony Levatini, and in the early part of my career as an OBGYN, I performed over 1,200 abortions.
Okay, we can go to the next one.
One of those abortions.
Okay.
Looked at the ring.
Okay, let's go to the next one.
While OPP is uploading the video, is there anybody who has a comment so far?
No, I've picked the right to unmute until we are done. Then I'll give people
Okay, sawa sawa.
time to comment.
Okay, no problem.
Yeah. So. My computer is freezing a bit, but it's okay.
gynecologist and I performed over 1,200 abortions. Today I'm going to describe a second trimester surgical abortion called dilatation and evacuation, or DD. The DD is performed between 13 and 24 weeks of pregnancy. After administering anesthesia, the abortionist uses a weighted speculum like this one that opens the vagina widely. Because second trimester babies are so large, this greater access facilitates a late-term abortion. Late-term abortion requires that the cervix be prepared 24 to 48 hours in advance of laminaria. Laminaria is a type of sterilized seaweed that absorbs water over 8 to 12 hours and swells to several times its original diameter. Once removed, metal dilators can be used to further open the cervix as needed. Once the cervix has been stretched open, the suction tube is placed inside. A baby at 20 weeks gestation is as big as the length of my hand, from head to rump, not counting the legs. The suction machine is turned on, and pale yellow amniotic fluid surrounding the baby is suctioned out through the catheters. With babies this big, they don't fit through catheters this size. The baby's bones and skull are too strong to be torn apart by suction alone. This is a Sofer clamp. The Sofer clamp is made of stainless steel. It's about 13 inches long. The business end is about 2.5 inches long and 1/2 inch wide, and there are rows of sharp teeth. This is a grasping instrument. When it gets a hold of something, it does not let go. The abortionist uses this clamp to grasp an arm or leg. Once he has a firm grip, the abortionist pulls hard in order to tear the limb from the baby's body. One by one, the rest of the limbs are removed, along with the intestines, the spine, and the heart and lungs. Usually the most difficult part of the procedure is extracting the baby's head, which is about the size of a large plum at 20 weeks. The head is grasped and crushed. The abortionist knows he has crushed the skull when a white substance comes out of the cervix. This was the baby's brains. The abortionist then removes skull pieces. He removes the placenta and any leftover parts of the baby with a curette, scraping the lining of the uterus for any remaining tissue. The abortionist then collects the baby parts and reassembles them to make sure that there are 2 arms, 2 legs, and all the pieces. Once all the parts have been accounted for, the abortion is complete. For the woman, this procedure carries a significant risk of major complications, including perforation, laceration of the uterus or cervix, with possible damage to the bowel, bladder, and other maternal organs. Infection and hemorrhage can also occur, which can even lead to death. Future pregnancies are also at greater risk for loss or premature delivery due to abortion-related trauma and injury to the cervix. As I mentioned at the beginning, I'm Dr. Anthony Levatino. And in the early part of my career as an OBGYN,
Okay.
I performed 1,200 abortions.
Thanks, OPP.
Yes, you're welcome.
Before we move on to the next stage, is there anybody who has a question or comment thus far?
You can raise your hand if you have a comment, and then we give you the mic, or you can put in the chat. Raise up your hand if you need to say something. There is a reason we're doing this. Just in case you don't know, some other times back we opened it and everyone was able to comment freely, and others started showing us other videos that were obscene. Yeah, so we started controlling so that we are able to account for everyone who speaks and who they are. So anyone with a comment, kindly raise up your hand so that we are able to give you the time to speak. Thank you.
Are there any hands
Or you
up?
can put in the chat, and then we will be able to see. I'm not yet seeing any hand up, so you
Okay,
can
so that
move
means we
on.
can continue.
Yes.
Okay, so Yvonne McKenna has a question apparently.
Oh, yes. Now McKenna has a question. You can unmute, McKenna.
Hello everyone.
Hello,
Hello.
Yvonne.
I hope you can all hear me clearly.
Yes.
It's not a question really. I think it's more of a comment. And I think people outside there are, especially the ones who advocate for abortion, I don't really think they're aware of what they're advocating for. Because if by the time you watch those videos and you are not, it does not trigger you in any way, then I feel like there's a lot of awareness that needs to be done so that by the time one says they are actually advocating for such, deliberately from such a innocent human being, I do not think it's right. It's something that should really be, it should really be condemned, not condemning the people necessarily, but condemning such practices in society because there's a lot of harm that is being done. And thank you, Dr. Eda, for what it is that you're doing. This awareness, a lot of people, myself being included, we are not aware of such kind of things. And by the fact that you take your time at this point to show us such kind of things, I don't take it for granted. So thank you. And yeah, that's all.
Yes,
Thank you very much.
much for your comment, Yvonne. It's true that people and the Bible says in Hosea 4:6 that my people perish for lack of knowledge. And the pro-abortionists are very careful to make sure that the women who are in a crisis pregnancy do not get an ultrasound. Because once you get an ultrasound, you'll be able to see your baby. And like I showed you, this is a baby who is 3 months old. That the women are being told it's just a blob of cells. Yet you can see their arms, their legs, there's a face, there's everything here. And all the organs are available from the organs are there from 8 weeks, and there's a heartbeat at 21 days. Even before the mother knows that she's pregnant, at 21 days, there's a heartbeat. Even if it's a rudimentary heartbeat, there's a heartbeat. At 21 days, even before she knows that she's pregnant. So it's very important that we enlighten you, and this is why Linda Vijana initiative exists. So the next stage that we'll go to is that I would like to invite Martha Ann Bore. Martha, are you there?
Yeah, I had seen her. Let me just look for her so that I can allow her to unmute. Yes, Martha is here. Yes, Martha, you can unmute.
Yeah, I'm here.
Martha Ann, how are you today?
I'm fine.
You're most welcome to the meeting.
Yes.
And you're most welcome to the webinar. And we would love you to introduce yourself briefly and give us your testimony, because your testimony is going to be very valuable information for this webinar. Thank you very much, Martha Ann, for coming.
Okay, would you mind turning on my video? That's not also appropriate.
You're not able to unmute your video?
Let me turn it on. Let me allow you to do it. Just a minute.
Okay, so we're going to have a short testimony from Martha Ann Bore.
Martha,
Okay,
turn on your video. Turn on.
Okay. I'm sorry. I'm in my bedroom. Actually, my name is Martha Bore. I'm a 58-year-old mom and grandmother. Actually, I'm known as Shosho socially. I come here to give the testimony because I say I'm a mother of 9. 2 of them are alive. 2 of my babies are alive. One is 30 years old, and my 30-year-old girl, and the other is a 24-year-old boy. In my youth, when I was a teenager, actually, I always say that if my parents talk to me, and if I knew this information, and if our parents talked to us about sex and our sexuality, I don't think I would have made the mistakes I made. And being somebody who's actually in this field, I found out the reasons why I made some decisions, but it was just for lack of knowledge. Yeah. So I'd had abortions in India where it's legal. I always say abortion is not healthcare, and an abortion gives mental stress, actually emotional and psychological stress. At the age of 17, I got pregnant when I was in India. And okay, I wouldn't, by the way, I did the counseling, so I wouldn't know, but it's about 16, 17, 8 or 17. I was in India and I was having fun. It's the first time I was away from home, having money and lots of attention. And we were just having fun, drinking and alcohol, and yeah, got attached to a boy, and we were having sex. And in all this craziness, I fell sick. I was really, really having, I was bleeding very heavily. So my boyfriend used to tell me, go to the doctor, because we had actually a hospital next door. And I would avoid it because we were drunk all the time. And I used to joke, at our kidney test, they'll find there's no blood in my alcohol then. I mean, there's more blood in my alcohol, not alcohol in my blood. So I used to procrastinate, but I became so sick that I took myself to hospital. And in going to hospital, they tested me, and the doctor told me that, okay, they found out I had worms, actually, by the way. And then he told me I'm having a spontaneous abortion because I'd been bleeding and it was not stopping. And I asked him, what was that? He told me, no, you're pregnant and you didn't know. And for some reason, the body has rejected the baby and it's coming out. So they did a DNC on me to clean me up. And I was there. But, once, that idea is there, because it is there, now somebody that can, you can go and talk to when you have a problem. So the next time, it didn't take long. Again, I got pregnant again. At this time, I went back to him and he told me, what do you want to do? And I said, what can be done? And he says, we can, if you want the baby, you can deal with it. And I opted for, I went back, talked to my boyfriend. They always panic, actually, and encouraged me to go. And I went. And this time, I remember I was put under. And it must have been one of the procedures, but I came out of that place. I came out, all I can remember is the feeling when I came out of anesthesia. And it was such an empty feeling. And that changed me somehow. Something changed in me because I was different. When I was relating to my boyfriend, it was very different. One thing I tell you about abortions, it's sad. That was my experience. When you tango, the two of you are there, but when you're in the firing line, you're alone. They usually sit, they're not very near, they're not near you. So that really started putting, there was a distancing starting to happen, or a withdrawal. But we continued, we continued together. And after some time, again, I got myself pregnant with the same guy. And this time, I took myself to hospital. And I think I've gone through all the procedures that I mentioned in abortion for abortions. So this time I was injected with saline, some solution, and I was left to have, I got my cramps. Actually, I gave birth to the child. That one too, I was just alone. And this time the lady told me, no, we're not going to do, because I'd left, because I'd moved from that place. I got now a doctor, a gynecologist. And she told me, but she had my history. So she told me, no, this time we have to give you family planning. So they put coils in me. The interesting thing, I was very allergic to rubbers. That's one thing. We tried that. That's the only thing I knew. But I was allergic to them. So she decided to put the coil in. With the coil, I got infections like anything. So it was removed, but still very sexually active. Then I got pregnant again. And this time my stomach was paining like anything. All this, I'm in India. And all this was by that between 17 and 24. I got pregnant again, and this time my stomach was really aching. But I was out, we had gone out of town to visit some friends. And when I went to see a gynecologist, and she told me I'm having an ectopic pregnancy and it's a danger to my life. She will deal with it. So that again was sorted out. And maybe she lied to me after listening to this, because they say when you have an ectopic pregnancy, it's the tube that is dealt with. But I know I have both of my tubes, so I don't know why she told me that. Actually, today is when I'm realizing, that couldn't have been that. But anyway, the baby was removed. And that was the final thing with me and this guy. I mean, we just, we broke up. And I was just minding my own business and all that kind of thing. Then one time he came back so sad, telling me, let's reunite and this kind of thing. And I said no. And I got pregnant again. And this time I had said I was going to have my baby. And I just disappeared because I knew he would convince me. But somehow he appeared again, and I don't know what powers they have over us. And actually, I had a pregnancy that was about 5 months. And that too came out. So that's when we finished with him. And I took some time, and then I got into another relationship where I got pregnant again. And this time, this guy was in hyper panic because he told me, I'll lose my scholarship, I'll go back home and all that. I don't know why he likes saving these guys or even rescuing these guys. And I decided to go. And when I went, the same doctor, it was like the Kenyatta, it was a county, not in their states, and their states are like counties. So in every town, they had a big hospital, like Kenyatta, major big hospital, a teaching hospital. So I went to her, and she was asking me, Martha, you should do something about yourself. This cannot go on, and this and that. And I remember now I was back on my back in a theater. And all I know, I don't know what they did, but I could not breathe. And I remember the anesthesiologist was saying she's in distress. And they stopped doing what they were doing. And I was taken back to the ward, and she came and told me, okay, what you do, can you go for a sonography? I don't think that time there were ultrasounds. And if there maybe they were too expensive. So we went, and I remember the doctor there asked me, why do you want to get rid of these babies? And I'm asking him, what babies are you talking about? He says, you have twins. And I'd gone with a friend of mine, actually our roommate, a guy, he's the one who had taken me. And I came out, I think they talked to him, and they thought, in India, such things is frowned upon, because what are you doing having sex and you're not married? So whenever they see you with a guy, I think that's your husband. So I think they talked to him. So when you're going back to the hospital, he's asking me, why do you want to do this, Martha? Stop. But in my head, I thought, oh my God, I was in a theater, they opened me, they opened my cervix, all that kind of thing. I'm here. I don't know what they've done. I don't want a disabled baby. I just made up my mind. So what they did, I went and they opened up my cervix. They put in some, I don't know, Edda, you know what they're called, to open up the cervix, three, like they're tablets or something. And I was there, and after, when is it? It took a day. And they kept on checking if my cervix was open and all. And after some time, and this time now you're put in the maternity ward. And here I am in a maternity ward, women are giving birth and all that kind of thing. And I'm asking myself, what am I doing? What is all this? I think my conscience was really eating me up. And I remember in the middle of the night, I just started getting crazy cramps. And I remember I jikokotted and went and found somebody, a nurse, I don't know what she was wearing white. And I just told her, help me. And she came and she told me to climb up on the bed. And she told me, they told me the legs are here. And that's how I got the twins. And all I could hear them say, the babies were thinking, they says, where do we put them? They said, put them in the side room over there. And then they said, well, the placenta, we are going to harvest, what are they called? Stem cells. We're going to use it for teaching. That's all I heard. I never knew. Later on, years later, when I knew actually there are things they do with baby products, abortion products. So I remember they left me there, and it was coming to morning. The sun was rising right in front of me, and I remember I looked at it and I just thought, God, I'm so sorry. And I got up and went to check where they put the babies there in a basin, and they were there hugging each other, and they were still warm. And I just told God, Baba, please forgive me. I'll never do this again. And there's something that breaks in a woman when that happens. The times I've done it, I was just broken totally. I felt not loved or anything. My boyfriend now was going out with my best friend. My life was just a mess. And I was always alone. And I remember that time it was winter and I was sitting down, and one time I just sat, because I've always wanted to be a mother, and a mother to many children. And I am still a mother to many children. Yes, they're just in heaven waiting for me. And I sat down and I decided that I'm going to have a baby. That will be mine. Nobody will take it. They will love me, because I think I wanted somebody to love and will love me back unconditionally. That was the biggest thing. You don't have babies to love you. Babies are the individuals that do their own things when they grow up. And that's how I got pregnant and adamantly hang on to my daughter. And I gave birth to her, the same doctor, same doctor. And I stayed with her in India till she was 18 months, and I came back home. When I came back home, my mom took her and told me, look for a job and all that kind of thing. I got a job, and I got into a relationship back in Kenya here. And within time again, I was pregnant. Somebody one day told me, you're one of the most fertile women we've ever heard of. And I got pregnant again. And I remember I told the man, he was a married man I was going out with. He told me they were separated with the wife. By the way, shock on me, they're still married till today. They're still together. They will tell you anything to get you into their bed or into bed. So when I told him that, he was telling me, oh, this can be done and all that kind of thing. And girls, you'll sit down and you're sitting, girls, you'll always have solutions for everything. There's always an idea. So somebody mentioned, I don't know if I'm supposed to mention their name, but the hospital that does that, the organization that does that very openly. And I remember I went to Kencom. The guy just asked me, how long? And I told him, and he told me it's this amount of money. There's no counseling they do and all that. And I was given a referral and told to go report 6 o'clock in Isili. Went there. Actually, now this time my boyfriend then took me there, and he was waiting for me downstairs. And I remember I went there, and there was such a long line of girls sitting there that are not being told next. And I remember I went and it was my time. I went there and with my name, we've got Bore is a very unique name. And interesting, I think God just wanted to just mulika me. The doctor who was doing this abortion was my brother's classmate in school. And he was asking me, are you Marcus, sister? And I look at him. But I remember I was injected with something. I really want to know what it is, but I know I've heard of it before. I was injected with some painkiller. I don't know what it is, but it will make you talk. I call it the truth medicine. You will talk and you will talk and you'll talk. I know this because when I gave birth later, the doctor said, the woman who cared at it, kama hajaniambia baba huyu mtoto ni nani, lakini kitambo atoke hapa tutajua. Because even her, I remember she was talking the way I was about 2 years back. So that happened. They did suction. And I remember I left there. You come in through one door and you leave toward the other door, so you don't see the other people who are waiting. And I went back home. I'd taken off, went back home, slept. The next day I was back to work. And I just decided to work and work and work and work. I was up for a promotion and I just sat down and something passed me. There was a training that passed me. And I remember I really quarreled with the boss, telling him that I have my life planned. There's a reason why I want to do this training, because next time I won't have the opportunity to do it later and all that and all. And they refused me to do it. So I sat down and thought, at this age, I was 33 then. At this age, this is my plan and this is that. I need to get pregnant, have my baby. I just want to have a baby and go on with my life, climb up the corporate ladder. And that one I remember just using the same life cycle, what we were taught, safe days and all that. I planned and I knew. When I got pregnant, I knew within a week I was pregnant. I always tell people, my 2 babies, they were not accidents. The ones I have, I actually looked for them. So I counted and I knew I was pregnant. I remember I told my friend, do you know I'm pregnant? She told me, Kwani? And I told her, I know. And I even know the date I got pregnant. And we went back to by the way, the doctor who did this in Kenya here was again my doctor again. I went back to him and I told him I want to keep this baby. And he said, it's fine. And he tells me there's no way you can know that you're pregnant within a week. And I told him, I know I am pregnant. He tells me, okay, go and come back after, was it 3 weeks? And I went back and it was confirmed. And even I knew I was going to get a boy and all, but that's when my life fell apart. Looking back right now, I was not born again then. I think God just stepped into my life. People always tell me, Martha, God loves you. My husband right now tells me, Martha, many people have died. That you're alive makes no sense, because you've got that. There are things that I've had that have killed many people. I always say that it's by his mercy that I'm alive, and it's by his grace that I live. So I had this baby boy of mine, went on working, but things never worked out for me. I was just, I don't know, I couldn't perform. I was a performer at work. I was getting a lot of money in commissions, but things were just never right. And yeah, that's what happened. And fast forwards, I get born again at 40. I start walking, getting discipled. I tell all that, yeah, this is what I did and all that kind of thing. But just know that, yes, Jesus forgives, but the consequences are there. You have to work this out. So I ended up in post-abortion counseling at 50. And that is when I realized what was happening to me. As one time I was listening about it. The Pearls and Treasures, Ketch used to do it. And I was listening to some ladies on TV. And I had all this anger. I had all this, that one of you lose esteem for yourself. Really, people will use you, abuse you. And you hate men, but you'll still let them abuse you. And it's just a crazy life. But when I heard this girl talking, and this girl had 13 abortions, and I was looking at her, that one of the kettle calling the pot black. And I decided to go. But most so that time, I was actually the coordinator for the Rehab for Crisis Pregnancy. And I used to feel so guilty. I know what happens here. I know what was there. And nobody knew except my boss. My bosses knew about my past. And when at 50, I decided to go. I went for the counseling and it was difficult, let me tell you, but I stuck through. Because actually I was threatened that if you don't do it, you'll lose your job. But I stuck through it, and I'm glad it's a deliverance. It's a healing and deliverance process. And I came out of it. And it made me reconcile. I fought with my mother all the times. At 50, we reconciled. And luckily, I had 5 years. Of course, she died 5 years later. And by the time she was dying, we had talked about this, actually. I'd told her about it. And she kept on laughing and was asking me, which man was this? Which baby, which man did you have? But those kind of things. We were that close. And all through, when the restoration came in, the healing, the being set free, it's a process. I won't lie to you. But restoration came in when I was 56. For the first time, I was proposed to and got engaged to a gentleman. 3 years later, last year, he came back to Kenya. Here he's a Kenyan, and we got married. Married in that we did the traditional ceremony because he had such a short time. We couldn't do the wedding because of logistics. And then I also injured my knee. So I was saying I was not going to do, because the pastors told me you can do a civil wedding and we'll come and bless you during COVID. We'll bless you we'll bless you there, or you come, you can go to the civil thing and come here, we bless you in church. But I said, I'm not going to have a memory limping because I was working with a walker. I was not going to do that. And I just told him, you'll come back in a year, we'll do this. Come back next year, we'll do this, right? I say I'm married because, yes, he's my husband, but I'd say that always do the right thing. Be blessed in church. Church, they say they are just clerks. Actually, they're clerks too. They're the ones who, the certificate belongs to the government. But being blessed by God, he is our beginner. He's the one who started families. So that's where I am. That's my story in short. But I can tell you, I got mental issues. I now run a foster care. I'm a foster mother. I have children with me from a girl who had issues like me. She's really misbehaving, and I've realized she had abortions, and I realized that's why she's like that. But because I'm fostering her children, I can't walk with her, but I've referred her to somebody else, and I hope she'll walk the process. But I walk the process with other ladies, and I've done quite a bit. My testimony has helped other babies be born. Women who listen to my testimony in different platforms, and they tell me, if it wasn't that, we wouldn't have, we changed our minds because of your story. There are men who see me and tell me, my girl wants to have abortion. Can you talk to her? I said, I can't talk to her unless she agrees. But what I can tell you, go and tell this girl, and I tell all men, don't marry a girl because she's pregnant. You will break up maximum 2 years. But always go and tell this girl really that this is my child for life. I will stand with my child. You'll take half of her crisis and stress away. And most of the time she changes her mind. In fact, all the time she's changed her mind. I have quite a number of men that I'm working with, and they tell me, if it wasn't for you, Mama, we would not have seen our children. And I coach them how they can also reconnect with the mother, the child. And most of them, they might not, they're co-parenting, most of them. And we say it's one child at a time. And I just keep on. It's a very dark place. I say I raid darkness. I go into hell to raid hell, to bring out people into the light. It's a very heavy ministry. And mostly sometimes I think somebody should start something for debriefing and post, and just to help caregivers in such a place. Because most of the people who do this are people who are hurt by abortion, who are in the industry. That's how you empathize with it. So that's my story. And thank you for listening to me. Yeah.
Wow. Thank you so much for sharing your story, Martha.
Yeah.
We're so blessed to hear. And thank you so much for being accepting to be vulnerable and sharing your post-abortion syndrome trauma. Because it's not an easy thing to do at all.
It's not.
And for the grace that you got, it's so wonderful that the story ended well, and that you actually got your healing in Christ. through the book Post-Abortion Syndrome Ministry Healing. And
Yes.
we're so grateful to God that now God is using you to heal other people. All these women and these men who are coming to you and for saving lives. You know, the Bible says that all things work together for the good of those who love the Lord and are called according to his purpose. Romans 8:28. So it is really a wonderful testimony. Thank you very much.
No, thank you for listening to me.
Yes, yes.
God will heal you that you can talk of your story. Anybody who's gone through that it is like you're talking about somebody else, you know.
Yes.
It's another life. So I just encourage people to come out. There's help out here. There's help out here. The world needs more heroes than heroes.
Yes, because abortion is a multi-billion-dollar industry run by Satan.
Yes.
They don't allow, they don't give platforms to women to share their stories. Neither do they want women to know that there's life in the womb. They just call it a blob of cells. So we're here with the truth, and we're so glad that you have helped us on this journey of getting the truth out there.
One thing, let me tell you, I've learned that the womb is supposed to be the safest place on earth. But when you have an abortion, it's a place of life. But when you have an abortion, you introduce death into the womb. That's why sometimes it's like life and death fights in your womb when there's a baby there. Maybe that's why some people get so many miscarriages. But let me tell you, any child born out of an aborted womb is a wounded, traumatized child. That is something I've learned. There's a lady who's doing that ministry from America in Kenya here called Healing the Womb, because your womb has to be healed. Because a child and seeing from there, they come out very confused, and they don't even know. And nobody knows what confuses them till you find out that there was a baby born aborted before them. Then you realize is that I have a child who I'm dealing with like that. He actually right now he thinks that he's gay. They get very confused. So it's just something of broken heart and brokenness that you should never start again. And if it has happened, go for healing. Reach out for healing. Yes.
And healing in Christ alone.
Yeah, healing in Christ.
Yeah.
It's only
The post-abortion healing ministries are not apologetic. They just say it is through Jesus Christ, the love of Jesus Christ. Because he loves us.
He is the giver of life. And once you tell him, I'm sorry, go to him and tell him, I'm sorry. God is the giver of life. And then Jesus will walk you through healing because he understands. He understands that we are just but weak vessels that make mistakes. And once you know it, go and sin no more. Don't do it again. Don't do it again. Yeah.
So all the women should know that it's not a quick fix. That the minute they decide to end the life of their child, they don't become unpregnant. They become the mother of a dead child.
Yeah.
And we said that the human soul lives forever. So, but then during the healing process, I believe that the child is given to God.
Yes.
And you realize once you realize that you have been forgiven and your child is in the arms of Jesus, then you get the full healing.
Actually,
because you know that you will meet again.
We release them, give them names, have mock birth certificates, and we know they're in heaven waiting for us in love.
Yes.
They know that when there's a poem that when they ask what happened to my mom, and God explains to them what happened, and they will embrace us in heaven. So it's a healing process, and it's finished. That cycle is finished in proper death for the proper burial for this child. And it's burial, it's a symbolic burial, not just whatever. But let me tell you, it is so freeing. It is so freeing. I'm telling you.
And the message, the message is that no matter what you've done, God is a loving God. So long as you repent and you turn to him, because anytime that sadness and that post-abortion syndrome that you went through, God allowed you to go through it because he loves you and he wanted to show you that something wrong had happened.
Yes.
Yes. So our God is he's a discipliner, and he disciplines us through that pain. Because the closest relationship is between a mother and her child.
Yes.
And once you lose that child, there's no way it can just be business as usual.
It
No matter
cannot
what
be.
the pro-abortion people try to tell us, the
No, you
pro-death camp, they're
dream.
always saying that it's just a
Mm.
blob of cells and you can get on with your life. No.
Even if
You're
it's a blob
mourning
of
your
cells,
child. Yes.
you remember the day you said this child would have been this old. You remember, you hear
Yes.
other babies crying. You remember, it
Yes.
haunts you. It haunts you. So you don't have peace. Let me tell you. And I believe it's God who doesn't want. You know that one of utasumbuliwa. Your conscience is sumbua you till you get peace. And if you don't get
Yes.
peace, you will go into alcoholism. You'll do so many crazy things to try and look for
Yes.
peace in the wrong places. But the right place to be at the foot of the cross. And there's healing there at the foot of the cross. Let me tell you, I know there's healing.
Thank you
I am
so
there.
much.
Yes.
I have one question for you, Martha. Did you have any challenges with the parenting? After
Crazy parenting. I overcompensated. When I would punish them, I'd feel so guilty. I was just something else. And I know my mom had my children, my daughter till she was 11, and my son till he was 7. And I got them back because I used to believe I was not a good mother. Then when I got them back, it was a struggle. And I always used to feel that I'm not a good mother. Till I learned that there's brokenness in parenting from abortion. And when I learned that, I tried. My son right now actually brings girls to me. He's a healer as well. And right now, I think he's been restored that he's working with me. He is in church. He says, you guys go and talk to my mother. Tell me, Mommy, can I bring another girl to you? You talk to. And this and that. That's what God does. He restores everything. He restores everything.
In fact, what we can learn from your story is that it's so much more than physical pain and all this. We heard about the side effects and the adverse physical effects from Dr. Levatino, but abortion is spiritual warfare. And like I said in the beginning, it is Satan's attack on God's creation. And there's a spiritual component. And what you have is a tragic triangle.
Yes.
There's always a tragic triangle. And on one corner is the perpetrator. On the other corner is the victim. And on the other, the other corner is the observer.
Yes.
So every time we have a tragedy in our lives, the body, the mind, when the mind is unable to process something, it tries to reenact the situation.
Yes. And
so your mind was saying, I've failed to understand this situation, so let me go back to that situation. And it's a very spiritual thing. And so you find yourself going right back into sexual relationships, also because of the craving for an atonement baby.
Yes.
So the women who have abortions also crave for an atonement child to make up for the lost child and also to make up for the emptiness in her life. And then she tries to overcompensate, like you said. Maybe she can become a permissive mother or very strict and very abusive. You know, they oscillate between the extremes. So they need a lot of help.
I oscillated between all three, being very abusive, being very permissive, and also sometimes of very strong parent and all that. And I really apologize to my children for even making the decision to have babies without their fathers. God intended every child to have a father and a mother. And all that. So it's just something. I tell you one thing, they tell you it's mental health issues. There are mental health, spiritual issues. People who don't know, they feel like a mental problem. And you can end up in Madare. There are enough women I know who ended up in Madare for post-abortion stress. But it's just spiritual breakthrough. And talk therapy. My counselor tells me, Martha, what makes you sane? She tells me, actually, I got PTSD actually from it. And
PTSD for the listeners is post-traumatic stress disorder.
And she tells me I'm a functioning post-traumatic stress disorder person. And I go to the extremes. I thought sometimes I was bipolar, but she just tells me, no, that's when they actually diagnosed me with that. So when you know what's happening to you, now I see the when it's coming and I stop myself. You see, I shut myself sometimes. I look for my me time and all that. So yeah, we do what we can with what we have. God doesn't waste pain. That's what I know. Whatever pain you go through, God doesn't waste it. He'll use it for his glory to bring out other people. Yeah.
Yes, and then what you said about losing that motherhood, because we are created to be nurturers.
Yeah.
And so once we participate in the death of our child, then we just completely, your identity is shattered as a mother. And so you don't see yourself as a mother. And actually many youth, sometimes the people who do healing and deliverance, when youth come to them with depression, they tell them to go back and ask their mothers whether they had an abortion, because many of these young people are survivors of abortion, like you said. When you're born in a womb or where there was an abortion, their sibling was killed. And so there's a spirit of death there. And so they have depression, which they don't understand. And when the mother confesses about her having had an abortion, the child always says, I knew there was something wrong, and I knew I had a sibling. It's called post-abortion survivors syndrome. And so many of the youth, because Mary Stopes, I won't be ashamed to say openly, has been here since 1985, killing our Kenyan children. And so these children are in their 30s now. And they actually have depression, which they don't understand. And we have many broken women who have not been able to talk about this. So thank you very much for sharing your story. And I'm sure you'll save a lot of, so I think we need to kind of wind up. But thank you so much. I really appreciate it. And many people will be helped by your story. Okay, thank you so much.
God bless you all.
Okay. Is there anybody with a question?
You can raise up your hand if you have a comment, a question. There was a comment from McKenna that was saying, thank you very much for sharing. That is Martha. That's very brave. And lots of other comments have come in from Catherine, thanking Martha. Yvonne, the same Yvonne, you're a brave lady, Martha. Thank you for sharing. Okay, any other person? Yes, Kevin has said this story of Martha has really opened up my blindness. Very moving story. Thank you very much for sharing. This is Catherine. Yes, Chris has also said good work, guys. Anybody who has something you'd like to say, just raise up your hand and then we will give you a few seconds. You can say something. Otherwise, our time is well spent. Dr. Eda, I'm not seeing any hand up.
Okay, yes, yes, so I think the testimony and the videos have been quite good. Excellent presentations. And these things need to be talked about more and more often. And yes, all things work together for good for those who love the Lord and are called according to his purpose. And God is a healer, and he loves all of us unconditionally. We are his children. And so no matter what you've done, you can be forgiven, if only you turn to him and repent. So this is the trauma of abortion. It is physical, it is spiritual, it is emotional, it is every single aspect of the person. And it's the greatest tragedy to ever befall humankind. And we want abortion to end. So if any of you can share this video, please, you yourself in your sphere of influence, whether you in your office, in your workplace, actually starting with your own family, there will always be somebody who will need to hear just from you. You are the only person who can stop a child, an innocent child being killed. And we pray for the day for all these NGOs and marriage stops to be removed from our country. And actually, they should never be in any country, because the blood is on, they have blood on their hands and they'll have to answer to it from God. So if there's no other comment, then perhaps over to you, OPP.
Sorry, I have a comment. I
Yes,
can't
Catherine.
see. I can't see where to raise my hand. I was struggling to find. I need to confirm something. You say the child born after an abortion is called an abortion survivor.
Yes.
And that is what that leads some of them to have mental issues like depression and any other.
Yes.
So is this question because I've had families where several children have depression, psychosis, and other mental issues. Does this mean maybe could be the mother had an abortion at some point?
You know, I think what we need to do is to raise awareness.
Yes, yes.
Because in healing and deliverance, they always make sure that they ask about the mother's pregnancy histories. Even every single doctor, although I know they don't do it, every single psychiatrist, every single mental health worker or health worker is supposed to ask how many pregnancies you have had and what was the outcome. This is the one question people are not asking. Because if it was a termination, if it was a deliberate termination of pregnancy, the amount of pain is very different from a miscarriage. Although there's pain when you have a miscarriage, still it was God who took the child. You didn't participate in the death. So post-abortion survivor syndrome, it's like if you are in a terrorist attack, like the Dusit attack. And you usually go to work, but that day you didn't go to work and all your friends were killed. There's something called survivor syndrome, and you just feel guilty about being alive. So it is very similar, the kind of depression, it's on a spiritual level, and it would be good for them to know their mother's history of pregnancy history and the outcomes of each and every pregnancy.
So Dr. Ida, the second, say you had an abortion now and you have 3 children afterwards, all 3 are abortion survivors?
Yes.
Or the one after their pregnancy?
All of them are, because the spirit of death is in the womb. And until you get healed, and it's a healing and deliverance, the spirit of death is overshadowing.
Thank you for that.
And also the psychological complications in the mother prevents the bonding with the other children. So you don't bond with the subsequent children, and you also, because like I said, that the nurturing aspect is completely blocked and you don't see yourself as a mother. So you're not able to mother your children appropriately.
Thank you.
Yeah.
And by the way, this survivor syndrome also happens to babies of miscarriage because they met death. You know, babies born after miscarriage, they met death. So that's why we teach also women to pray for their children when they're in the womb and afterwards. It's just a wholesome thing that of healing, that with awareness, you get to know about it. And then you can help your children out of it.
Yeah, and you know, for example, the abortifacient contraceptives like the coil are 100% abortifacient. So women who are using the coil are not told that they're aborting their babies. So there's still a spirit of death. They think it's a period, but their baby actually was prevented from implanting. So there's still a spirit of death. The whole contraceptive issue is a problem. So that's why we give them the options of natural family planning and teaching them the fertility cycle. Because that one respects the history, the anatomy and physiology of the body.
Wow.
Thank you very much. Hey, Leo, if Catherine still wants to speak, I'd like to give.
Yes. I had a college student who was arguing that the rape victim, they won't even want the baby So I was trying to explain that the crisis is not the child, but the event that happened. So what would you advise from your position, Dr. Ida, on the issue of someone insisting on terminating, killing a child because they were raped?
You see, there are several issues there. Number one is that that rape should never have happened. Rape is a horrific, traumatic incident that should never have happened. And rape should be prevented, and it should be punished with it should be severely punished. Yeah. And the woman is very traumatized. And many of the kind of people who would be perpetrators of rape would really push for abortion because they do not want the DNA tests. So the DNA, the woman needs to know that the baby is half her. It has half of her DNA and half of the rapist. So it's still her child. And definitely you have to validate her pain. But the child is completely innocent of the father's crime and should not be punished or killed for the father's crime. The child is made in the image and likeness of God, no matter how they were conceived, whether through rape, whether through incest. So give her the options of parenting or adoption, but definitely not killing her child, because when she kills her child through abortion, she will suffer double the trauma.
Yeah.
She will suffer not only double, but multiple trauma, because she's still trying to get over the trauma from the rape. And then you add the trauma from the abortion. And that one really, really is it's exponential. It's not 1 + 1 = 2. And then the child is half of hers, and she can bless a couple if she gives up the child for adoption. We have the adoption agencies, and and studies have shown, actually these women have been studied for, and they've been followed up. That's how I'm able to confidently say that the ones who go through abortion are very traumatized. The ones who decide to give life to their child actually heal much faster from the trauma of the rape, because their conscious decision to give life to the child actually it does something. It actually removes the helplessness that it cancels the helplessness that they felt during the rape, because they actually made a conscious decision to give life to the child. It actually undoes the helplessness that they felt during the rape. But rape shouldn't be happening. It's like saying now they, condoning any crime and saying that now that there's a lot of stealing, we should just condone it. No. It's very wrong what happened to her, and she should be validated, and she should be given all the treatment, tested for HIV and all that. But definitely that child, God has a plan for that child. There's a lady who was raped during war. I don't know whether it was in South Sudan, and she was actually a refugee. And do you know what happened? When she was raped, she conceived a child, and she gave birth to a child. And all her family members were killed in that war. So this child that she gave birth to was her only living relative. So you never know what plan God has for you, and what plan God has. Every child is a wanted child, no matter how they were conceived. God has a plan.
Chris, maybe you can comment. You wanted to say something. Let me allow you to unmute, and then I think we can close. Let me look for Vice. Chris, unmute.
Okay, thank you, Paul Peter.
Yes.
Trust I'm here. Everyone can hear me, yeah?
Yes,
Yes,
we
Chris.
can.
Okay, so for me, just I wanted to mention something, but Dr. Eda has mentioned it towards the end of what she was talking about. Myself also and my wife, we're involved with counseling people, and also through some marriage preparation classes. And I'm shocked actually by mother's testimony. I've never heard open testimony. I've talked to women who have done abortion, but they fear. I usually say they fear being open and vulnerable. They hide some things. But now mother has made me understand what I had researched about, what I had read about, what doctors say it's true, everything about parenting. So I just want to thank her, continue with the same mentoring more and more women. And another thing that I usually say is as we fight about abortion, it's good we look at the cause, because JP2 said abortion and contraception are fruits of the same tree. So there's no way somebody can fight abortion and also not fight contraception, because most of these contraceptives are abortion deficient, as Dr. Eda. That's what I wanted to mention too, as Dr. Eda said. Because somebody using the UTI, the copper IUD, is aborting almost every month, every 3 months, like once or thrice, and he or she doesn't know. So you are more or less like the other. It's only that maybe you don't know. So mine is also an awareness, and also the women who use the pills. I usually see women fighting breast cancer, and one of the leading cause is breast cancer is the pills, and no one talks about, even the women who are fighting it. They don't fight it. They don't say anything about it. So that's what I wanted to say. Otherwise, Mother and Eda and the Linda Vijana Initiative OPP, thank you for the good work. And Mother, I was shocked. We were here with my wife. We have not slept. She was shocked with the testimony. She has never had. We have never had an open testimony like this one. She was here. She has gone to sleep right now. So she was shocked. Actually, she has not even believed it. So thank you. Keep up the good work.
Thank you very much, Chris. It's just that we kind of run out of time, but you've made up a very important point. We need to go to the root cause. And actually, anytime, any part of the human life cycle that we shared last week, when it's destroyed or abandoned, then you get abortion, the root cause of abortion. For example, it is found, studies have shown that children who are emotionally abused and neglected are much more likely to abort their children. And in turn, they're much more likely to, after having an abortion, they're much more likely to abuse and neglect their children. So there's definitely a correlation. And people need to be taught about biblical sexuality. People need to be, parents need to be empowered not to abuse their children, either physically, emotionally, sexually, because we have many broken parents out there who are becoming parents before they're being healed. And they're also getting married before they're being healed. So any part of the human life cycle, when it is distorted, you will get the outcome of abortion. Abortion is just a symptom of a very sick society, a very sick family. So children who are not emotionally connected with their parents will be more likely to, because they have something that we call attachment trauma, they're more likely to have relationship problems and get into toxic relationships and become sexually active in search of love because they never felt loved or validated. And also the side effect, the effect that you're talking about of contraceptives being carcinogens and actually cancer causing, abortion also causes cancer. So when you combine abortion and contraception, the effect on cancer, breast cancer, is exponential because you have a lot of immature lobules in the breast. So these immature lobules are what we call cancer prone. So in abortion increases the rate of breast cancer, but you never heard anybody talking about that. Even the World Health Organization on Breast Cancer Month, Breast Cancer Day, because all this is the conspiracy of silence. And
I think that is a new topic we may need to set for it another time. Almost 1 hour after the hour. So I think we need to bring it to an end. Yeah, thank you very much, all the contributors and participants. I'd like to call Helen Masharia. She's a counselor with very many years of experience. She can make comments and close for us.
I'm sorry, Otieno, Yvonne's hand was raised for a while. Yvonne Makena.
We might need part 2.
Yeah, Yvonne, we are almost 2 hours into the... I'm not seeing Yvonne. Yvonne ni kama yuko.
No, she's there and she had been raising her hand. She was the last one.
She's still there.
Okay. Yvonne, unmute and speak.
I'm sorry, my connection was kind of disabled because there are some Wi-Fi issues. But you see now, like, I think I have a question because there was a match that we attended when now I got to meet Dr. Eda. It was on 26th March. And I've been able to discuss the question of abortion with a lot of my colleagues in school. And most of them who advocate for abortion, the one key question that they normally ask me is, okay, fine, we are pro-life, we advocate for children not to be aborted, right? But then now they ask me personally, how many people do you actually know who have adopted kids? And what kind of solutions are we bringing to the table as pro-life? And I find that a challenge because now, like, how do I get to answer them? So I was kindly requesting if you could just brief me on, especially on the point of, okay, fine, we advocate for pro-life. We are of the opinion that children should not be aborted. But then what are some of the solutions that we can actually give to these people that they can actually say, hey, wait, I think honestly, this is a good course that I should take. So yeah, that's my question. Just briefly, then now we can close the meeting.
Thanks, Yvonne. We have crisis pregnancy centers. And these crisis pregnancy centers, we also have Kyotas, where the women, unwed mothers or women who have been rejected by their families are able to raise their children. And they also have like Pearls and Treasures Trust that takes it upon themselves to give these women a vocation so that after the child is born, they will have some way of earning a living. So the Kyotas run by Dr. Jean Kagia, and also the Pearls and Treasures Trust does that. Myself, I have a foster daughter. I think if every single family took in one child, it wouldn't be too expensive. And we have also an adoption agency. They are called Little Angels, and they do connect children with their mothers. The thing is that most mothers, with their foster parents, the thing is that most mothers, they're given a grace period, and they're told that within 8 weeks, they can decide to keep the child. Many of them decide to keep the child because it was a crisis pregnancy. So in a crisis situation, you do not kill a child. You sort out the crisis. And the crisis is that they've been rejected by the boyfriend or by the father or the parents, and they feel that they're not able to take care of the child. So when you counsel them and you let them know that you're there for them and you'll be able to talk to the parents for them, you'll be the go-between, or you'll help them to get a vocation or link them to one of the Kyotas that take care of women. And also give, so the options are parenting or adoption, but definitely not killing the child, because that will last with them for the rest of their life.
Yeah, and a quick point to add to that, Yvonne, for students and anyone who is not married, we are usually campaigning on chastity. You can also work on secondary virginity. The thing is, the world is very highly sexualized, and we are working on telling our teenagers and young adults that you can't abstain. You can abstain, it's possible, only that the world is showing us that it is not. So as you talk to them, tell them there's the option of staying chaste until you think the time is right. And also not giving the right information, as I can't remember the gentleman that spoke on also contraceptives. There's what we talk about, the fertility cycle, which will help better instead of the contraceptives.
Yeah, you see, the contraceptive mentality gives people, it makes it sound like sex is a right, sexual pleasure is a right. And people need to know that it's very normal for people who have sex to become pregnant. So we do teach chastity and secondary virginity, like Catherine has said. Chastity is the best way, the 100% way, and character formation, so that somebody can make the right decisions in life.
And when I got born again at 40, till, do you know, I did secondary virginity. The girls would never believe, tell me, Shosho wacha kudanganyana. And I tell him, yes, with God, let me tell you, you can be chaste. You can be chaste.
Chastity is a
Thank you.
beautiful thing,
Yeah.
but it's not being marketed.
Thank you very much. This topic is sweet, emotional. It's not going to end soon. We must bring it to an end. And thank you all for participating. Helen, would you say something and maybe pray for us? Then we close. It would not be good to end without hearing your comments on the same. You can unmute. Helen Masharia. For those of you who don't know, we've been working with Helen for a number of years at St. Paul's Free Medical Camp, which was happening almost every year until the time that COVID came in. And she was giving talks on these issues, trauma, stress. I don't know if she is able to speak. You can unmute and speak and pray. Seems like she is unable to. I will ask, let me ask, I'm not going to give Daniel time to say anything because we are out of time and he just came in. So let me give the same Yvonne. Maybe Yvonne, will you pray for us? You close for us the word of prayer. Thank you. Yvonne, unmute.
Okay, we can pray. Okay. Dear Heavenly Father, we want to thank you so much for this webinar. We thank you for all that we have learned. We thank you for Dr. Eda. We thank you for the bravery that you have given to Mother Anne. And we thank you because through her, she's going to show a lot of light to a lot of people outside there. We thank you for everyone who has been able to participate and how we pray that, Lord, even as we disperse, that, Lord, through whatever it is that we have learned, we may shine light upon the other people in the society, oh dear Lord, and that it may help people to understand that abortion is murder, that abortion is not healthcare, and we all have duties, oh dear Heavenly Father, as your stewards to ensure that life which is sacred is upheld in our society. This we pray, believing and trusting in your holy name. Amen.
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 The Father, Son, Holy Spirit. Amen.
Amen.
Have a blessed evening. Let's keep talking. Martha, I hope you don't mind if we share that story out.
No problem. No problem.
Thank you very
Thank you
much.
very
Really appreciate.
Yeah, thank you. Thank you. Thank you very much. Let's meet again next month, a time like this, the first Friday of the month. The first Friday of the month from 9 p.m. Thank you.
Okay.
Martha, thank you so much.
No, you're welcome. Anytime. Anytime. And anybody can reach me for help. I'm a good show.
Did you give your phone number on the chat?
We met. I remember we met. I still have your number. I was just confirming. We met at Pulse event.
Yes, we did the lighting candles. Yeah. My number is 0722 314462. I'm always available. I'm on Facebook and I'm on WhatsApp. I do most of it online, the counseling. I do a lot of it because people are terrified to talk out one-on-one.
Thank you.
Another thing, probably people find a challenge because the